and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
We hardly ever screw up, but we just screwed up. Okay, today we're going to talk about the Quadratus Lumborum, how to stretch it and provide some pain relief to it.
Right, and this was a request from one of our viewers, and she really wanted to get this on, so I hope we get it in time before her quadratus gets too tight. But the Quadratus Lumborum is quite a mouthful. It's a muscle in your low back, and we're going to use our skeleton Bonaparte.
Napoleon Bonaparte.
Yeah. So if you look at the red muscle right here, it's deep.
I would call that pink.
Well, yeah, Bob, but...
All right. Oh, it's red on this side.
There you go.
Oh, it's pink on this side.
Yes. It's a deep muscle. You've got the erector spinae group, which is quite a hefty group that goes up and down the whole. So it's a deep muscle, but it can tighten up. You can see it connects to your pelvis here, or your iliac crest, and it connects up along the vertebrae here and to that bottom rib.
Okay, the 12th
so
rib.
when this tightens up, it pulls you over and it helps stabilize the pelvis. And what we want to do is, let me give an example, Bob. This may tighten up if you sleep on one side a lot.
That makes sense to me, Brad.
Because then your pelvis rotates and it'll shorten up on the top. And if you sleep like that all the time, you may have a tight QL. I'm going to call it QL.
Sure.
Because it's easier to pronounce. So if you got a tight QL on one side, it may tilt your pelvis and cause some pain.
Sure.
There's a lot of other reasons, but let's get into
anytime you have a tight muscle, it's a problem.
Right.
Yeah.
Let's get into how to stretch it. And first, let's talk about some soft tissue work.
Okay.
Okay. So the first thing I want to talk about is either using a tennis ball or you can use a lacrosse ball. And you're going to lay down on a floor. Carpeted floor works the best. You're not going to do this on the bed for sure. Mm-hmm. You take that, and you're going to find your pelvic bone right about the belt line.
So
just
I'm going to show on here, Brad.
There you go. You show them on there, Bob, and I'll show
right
them
above
here.
the pelvic line, right here.
So you got to find it right in there, and it's got to get through those erector spinal muscles and into the QL muscle. And the big key to the big secret to this is just learn how to relax.
Okay.
And let it relax.
You put it in place, and you just let nature do its business.
I'm going to even put this in there. It might be easier to see. And you're just going to relax and let that ball get deep. You can move around.
I don't think we're going to be able to see either of them, Brad, but that's fine.
Yeah, it's in there. Believe me, it's in there.
It's in there.
It's in there. And
so you're up against the spine, but not on the spine.
No, not on the spine.
And you're above the pelvis.
Exactly. And you will feel it, because right there, and once you get on it, you just relax and let that pressure go in and let it release. It's like the other soft tissue rules. After about 20 to 30 seconds, you should feel that tight muscle. Right, and it shouldn't create pain at that point. It should feel like it's loosening up.
I always like exercises like this because it's basically, once it's in place, you just relax.
Right.
You can't do that. Yeah.
You just move around a little bit, and you will feel it where to go with it. There's no question about that. And you're going to work that for 2 to 3 minutes. You can go longer if it's feeling good. I wouldn't fall asleep with it on there, though, Bob.
Right.
That might cause a problem.
Could be a problem.
That might create pain.
So you have other options, Brad?
Yeah. You can use one of these. This is a back knobber.
Right.
There's a Theracane that works similar to that.
Yeah, there's a whole bunch of different types like this.
Now this is nice. It's got 2 different diameters. I'm going to use the big one. You get in here, and you'll see you can get a lot of leverage. I put that knob, that's why they call this one the back knobber, right on that muscle where I had the ball before, and I just push up this way, and it's all leverage.
You got good leverage.
Oh, yeah.
Exactly.
Ooh, there. And you can... I'm not working hard to get the pressure.
Unfortunately, you wore a shirt that's the exact same color as the...
Oh, Bob. Here, maybe you better do it.
Well, I could try it, sure.
Yeah, I think you should, Bob. That'd be fun.
Oh, so I'm putting
That
it
way you
right
get to lay
in the
down.
spot.
You find that muscle spot there just above the pelvis?
All right, and I'm going to pull toward me. That does work good.
Yeah, you get a lot
of
leverage.
Very little pressure.
Right.
And I can put a lot of leverage on that.
Yep. And once you get that sore spot and you hold it, after 20 to 30 seconds, it starts to feel better, or you get that numbish feeling, you know you're getting some progress made.
And this is going to work the muscles even above that too. So I mean, if you're having trouble with those, you get a little secondary benefit from that. So
all right, now after you do that, or if you don't have that, you can go right to stretching it. This is kind of a harder muscle to stretch, in my opinion, Bob.
Yeah, it is. I agree.
Yeah.
It's a difficult one.
This is the way I like to do it. I call this hook line, Bob. You're going to lay on the floor, not on the bed again, and you're going to shift like this. Keep your
What
knees
side are we
together.
stretching first, Brad?
All right, now I'm doing the right side.
You're stretching the
Yep.
right side. Okay.
My shoulders stay flat, so I'm rotating the pelvis here.
So for the Packer fans, that's this side.
Yeah, Bob. Why, Bob? Why?
Okay, I'm sorry to interrupt you, Brad.
Yeah.
Where are you at now?
So we rotate.
You rotate.
Keep the shoulders flat.
The shoulder stays
This hip-
down.
This hip comes over. And what I like to do is take this right leg, the top leg, and bring it over, and that twists the pelvis over,
Oh, yeah.
stretching that
Gotcha.
out.
Yep. I got you.
Just relax. Yeah, but don't push too hard. You got a lot of leverage here, Bob. He's
Okay.
trying to break my back, I think. Oh,
Got it. Yep.
okay. The other one,
sense.
if you're flexible in the...
Can you show it this way too, Brad?
Oh,
Show the
yeah,
left
you're going to have
side.
to
Oh,
take
it's
this
gonna-
off. That's all right, Bob. Oh, there we go. I should balance it
So
off.
it's going over so you can see it from the other side
Yeah,
too.
sure. That shoulder staying flat over here like this, and get it to stretch.
And again, you're stretching some of the other lumbar
Yeah.
muscles, so it's
Yep.
the
And, yeah, and
paraspinals.
if this is creating some sharp pain or some unusual pain, you just stop. This should feel like a good stretch. Nothing.
And that's always the case. Watch your
Yep.
there, Brad.
Yeah, look at that. Okay, now there's one other way to do it. If you're flexible in the look at that, Bob. Now it's going to fall apart. Take it off anyways.
Okay.
You do one of these stretches like this, except for you're going to go over to one side.
Gotcha.
Yep. So on the floor, you can do the ballerina
Sure.
stretch. Yeah, I should take ballet perhaps.
Yeah, maybe you should. You look like the type.
Yeah.
So,
All right, so that's the cue all, how to work it, get some soft tissue work in it, and how to stretch it. So good luck with that.
good that we
and,
finally did it. Make sure you subscribe to us if you haven't already. And remember, we can fix just about anything.
except for that broken heart. But we're, oh yeah, there
Right
it is.
here. No, right here.
Oh, Bob, why?
Thanks. Thanks for watching.